Hello everyone. Today in this video I am going to tell you the details of breast crawl method. So first introduction, then what is the method, what is the sequence occur during the breast crawl method, and what are the benefits to the mother and the baby. By breast crawl method we can initiate the breastfeeding within half hour of delivery, and it is the only method by which we can start the breastfeeding within half hour, which will be labeled as a early initiation of the breastfeeding. So also ask in the exam that by which method you can initiate the breastfeeding early. So at the time of birth, natural crawling towards the mother's breast occur when we keep the baby in the prone position over the mother's chest and abdomen. Whenever baby is full term, having normal tone and cry immediately after birth, then we have to start breast crawl method. If baby is having poor tone, not cry immediately after birth and preterm, then we have to start the resuscitation. In such case, we cannot do this method. So prerequisite for this method is baby should be full term, should cry immediately after birth, having the normal tone. Then only we will keep the baby in prone position over the mother's chest and abdomen. And by this method, neonate locate the nipple by crawling and self-attach for the first breastfeeding. So in this method, baby is placed in skin to skin contacts on the mother's chest and abdomen and should be covered with the blanket. So here in this image you can see here is the baby's face, and this is the mother's breast nipple, and baby is over the chest and abdomen and covered with the blanket. After drying and stimulating the baby, we have to position the head of the baby toward the one side, so to ensure the airway is open. And neonate locate the nipple by crawling and self-attach for the first breastfeeding. Shortly after birth, this method is very helpful to initiate the breastfeeding. What is the breast crawl sequences? There are 9 stages. After birth cry, when we keep the baby in breast crawl position, first baby will be relaxed. Then after awakening stage occur, then baby become active, then resting. Then by crawling, baby localize the nipple, and by rooting reflex, baby can start the sucking. Between that, baby first familiarize with the mother's breast and the nipple, and after sucking, after taking the first feed, baby sleep. So these are the 9 stages of breast crawl method, or we can mention as a breast crawl sequences. During the breast crawl method, we have to continuously monitor the baby for breathing, color, temperature, and the tone. So during the routine newborn care, during this breast crawl method, all the vitals of the newborn should be monitored regularly. And we have to see airways open, any secretions are there, or temperature of the baby is normalizing slowly. And during the skin to skin contact, mother should also feel the breathing of the baby, and we have to also monitor the breathing pattern and the breathing of the baby. So during this method, all the vitals should be monitored regularly. What are the benefits? First and most important benefit is early initiation of the breastfeeding occur by this method. It also promotes the successful initiation of lactation. As the baby get the first breastfeed within half hour, lactation will be established and baby can get the subsequent breastfeeding after that. Baby is also in the skin to skin contact with the mother. So all the benefits of skin to skin contact will be there. First, baby will maintain the temperature. More emotional bonding between the mother and the baby occur, and the protection from against various infections also by this method. So thank you so much. This is all about the breast crawl method.